You've probably tried everything for it. A tennis ball against the wall, a foam roller dug into your upper back. Someone's thumbs pressing hard into that one spot between your spine and your shoulder blade, promising to release the knot. And for an hour, maybe two, it feels better. Then it comes back. Same spot, same deep burning ache that sits right along the inside edge of your shoulder blade, the one that makes you want someone to reach inside and just squeeze it. Here's the uncomfortable possibility nobody mentions. That knot you keep massaging might not be a knot at all. Let's start with what's actually back there. Running along the medial border of your shoulder blade, the edge closest to your spine are two small stabilizing muscles, the rhomboids, major and minor, and just above them, the levator scapulae. Together, they do a quiet but constant job. Every time you sit up straight, pull your shoulder blades back, or simply hold your arm up for more than a few seconds, these muscles are firing, anchoring your shoulder blade against your rib cage so the rest of your arm has something stable to work from. But these muscles don't move on their own. They're controlled by a single, specific nerve called the dorsal scapular nerve. It branches off from your cervical spine at the C5 level in your neck and immediately does something a little unusual. It pierces directly through the middle scalene muscle in your neck before traveling down, threading beneath the levator scapulae, and running along the underside of the rhomboids themselves. That detail matters more than it sounds like it should. This nerve doesn't sit beside the muscles it controls. It runs directly underneath and through them, which means if those muscles become tight, thickened, or chronically overworked, the nerve isn't sitting safely nearby, watching from a distance. It's being physically compressed by the very muscles it's responsible for controlling. This is dorsal scapular nerve entrapment, and it explains something that trips up a lot of people, including a lot of well-meaning practitioners: why the pain doesn't listen to muscle-based treatment. Think about what a muscle knot actually is. It's a localized area of sustained muscle tension, and the standard fixed pressure, heat, stretching works because it's addressing tension directly. That approach makes sense if tension is the problem. But when the dorsal scapular nerve is entrapped, the tension in the rhomboids isn't the root problem. It's a downstream symptom. The nerve is irritated, which disrupts how efficiently it can control the muscle, which causes those muscles to become inefficient and overworked, trying to compensate, which creates more tension, which puts more pressure on the nerve running underneath it. You end up with a closed loop, feeding itself. This is exactly why the tennis ball works for an hour. You're temporarily calming the downstream symptom. You are doing nothing to the nerve compression causing it. So, how does someone actually end up here? The overwhelming majority of cases trace back to one shared cause: sustained poor posture, especially the forward head, rounded shoulder position that comes from hours spent at a desk, looking down at a screen, or driving. In that position, the muscles along your shoulder blade aren't resting. They're working overtime, in a lengthened, disadvantaged position, trying to hold your shoulder blade in place against gravity and poor mechanics for hours at a stretch. Add repetitive overhead activity, weightlifting, swimming, racket sports, carrying a bag on one shoulder for years, and you have a nerve running through tissue that rarely, if ever, gets the chance to fully relax. Here's how you can start to tell the difference yourself without needing imaging. Classic muscular tension tends to respond, at least somewhat, to stretching and heat, even if only temporarily, and even if it returns. Nerve-based entrapment often doesn't respond meaningfully to either. The pain quality also tends to differ. True muscular soreness is usually described as dull, aching, or tight. Dorsal scapular nerve pain is more often described as sharp, burning, or knife-like, sometimes radiating toward the neck or down the outer arm, though notably, usually without the numbness or tingling you'd expect from a nerve problem lower down the arm, which is part of why it gets confused with something purely muscular in the first place. In more chronic, long-standing cases, there's a more objective sign, because the dorsal scapular nerve is a motor nerve. Prolonged entrapment can lead to measurable weakness in the rhomboids and levator scapulae, and in some cases, a subtle winging of the shoulder blade, the inner edge, lifting slightly away from the rib cage during certain arm movements. That's not something a muscle knot does. That's a sign the nerve controlling that muscle isn't firing the way it should. This is also why standard imaging so often comes back clean. An MRI is very good at showing you structural damage, torn tissue, herniated discs, bone abnormalities. It is far less reliable at showing you a nerve being compressed by adjacent, otherwise normal-looking muscle, which means a person can have textbook dorsal scapular nerve entrapment and be told, accurately, that their scan looks completely normal. The scan isn't wrong. It's just not designed to see this particular problem. So if stretching alone doesn't fix it, what actually does? The consistent theme across clinical approaches to this condition is that treatment has to address the mechanics causing the entrapment, not just the muscle tension it produces. That generally means two things working together. First, calming the acute irritation around the nerve itself through targeted soft tissue work, addressing the muscles the nerve passes through, not just the ones it controls. And second, and more importantly, for anything to actually last, correcting the postural and movement patterns that put pressure on the nerve in the first place. That specifically includes strengthening a muscle people rarely think about in this context, the serratus anterior, on the side of the rib cage, which shares the job of stabilizing the shoulder blade and can take pressure off the rhomboids and levator scapulae when it's doing its share of the work properly. This is also the part where most people give up too early, because it doesn't feel like the tennis ball. There's no immediate hour of relief. It's slower, and it's about retraining a mechanical pattern that may have been building for years, which is exactly why a structured, sequenced approach matters more here than almost any other kind of shoulder pain. If there's one thing to take from this, it's not stop stretching. Stretching isn't the enemy. It's that stretching alone is treating the echo of the problem, not the source. The actual source is a nerve running directly through the muscles it controls, in a region of your body that spends most modern days working overtime in a position it was never built to hold for 8 hours straight. Understanding that difference is the first real step toward fixing it, not massaging it into temporary silence every few days for the rest of your life. If this helped make sense of pain that's been confusing you for a while, the full breakdown of the exact mechanics and a structured approach to actually addressing it is linked in the description. And if you've been dealing with this exact spot for a while, drop a comment. I'm curious how many people have been told, it's just a knot.